everyone, and welcome to our product roadmap update for Gentu. And thank you all for taking the time to join us today. I'd like to begin today by acknowledging the traditional custodians of the land on which we stand and meet virtually today. And for me, based in Brisbane, that's the Turrbal people and the Yuggera people. And I'd also like to pay my respects to elders past, present, and emerging. My name is Niamh Tobin, and I'm the Director of Product Strategy and Design. Also presenting today will be Lucas Arundel. Lucas is the Head of Design within the Practice Management division, and he's going to chat to us later in the session about our recently launched craft group. Now, today I'll be talking you through the Gentu product roadmap, sharing what we have released recently in what's new and improved, what you can expect to see in the Gentu product over the coming months. And then finally, as I mentioned, you're going to hear from Lucas about our recently launched craft group, which is a new program which is enabling us to ensure that your voice is heard in our product roadmap decisions. At the end, we'll have time for Q&A, so please add any questions you have to the chat throughout the webinar, and we're going to aim to answer those as we go, but we'll also try and answer a few right towards the end. Now, before I jump into the product roadmap updates, I just want to spend a minute sharing a bit about our platform vision, as this is how we see ourselves helping you, the medical professionals, deliver better health outcomes in the coming years. Our practice management systems vision is centered around our technology platform. And this platform is important because it's what's going to enable us to provide you with ongoing innovations into the future. And these innovations in our products are really targeting three key objectives. The first one is to improve the patient experience by providing tools that will help you automate the patient journey. The second is focused on how we can connect up what is a very disconnected ecosystem today and ensure that you have the data that you need at the point of care with the patient. And the third area is to bring data-driven insights into your workflow. So in this, we think about how we can deliver on clinical decision support, workflow assistance, and providing you with insights that can improve your practice's performance. But of course, all of this is only a reality alongside Genie and Gentu, which are our core practice management system products. And so the updates I'm going to provide today will really be centered around what's happened in Gentu recently, and then what you can expect to see in Gentu in the coming months and progress towards these three objectives. The great thing is that with your support, Gentu is doing incredibly well. As we look at the number of specialist practices that has moved to the cloud, we know that over 40% of practices in Australia now have actually made that shift. And of those that have moved to the cloud, more than half of them are using Gentu, which is a really exciting milestone for us to be hitting. This makes Gentu the fastest growing cloud practice management software in the country. And currently there are over 1,800 practices using Gentu. This means that Gentu practices are supporting the care of 12 million patients and have provided more than 32 million appointments and 3.2 billion in health services over the past number of years, which is just a huge impact on the health system in Australia. Over the past year, we've been focused on improving the core experience of Gentu and also to get Gentu ready for Genie customers to migrate to. And so we've significantly increased the number of teams that are working on Gentu. So the core features around the appointment book, correspondence, clinical documentation, and so on. But we also now have a dedicated team that's working on our mobile app. And we have two teams that are focusing on integrations into Gentu, which we know is a gap that currently exists. So to identify which are the most important features for us to be working on, we really have been listening to your feedback on what needs to change. And over the years, we've built a rigorous voice of customer system, which is centered around capturing feedback from every interaction that we have with you, which can be seen here on the side. This feedback repository now has thousands of pieces of feedback, and we regularly review this to understand what is the most important thing for us to focus on. Now, the feedback that we've received so far from you highlights workflows associated with managing billing, payments, and claims, managing outgoing correspondence specifically, and then booking and managing appointments as the key areas that you want to see improvements in. Within managing billing, payments and claims, which is that big blue section, you specifically wanted to see improvements to quotes, invoices, and we actually had over 800 pieces of feedback in this space. You also want to see improvements for managing claims. Specifically, there was a lot of feedback around being able to easily finalize claims and make sure that the claims control area was tidied up. And you've also asked for improvements on how payments and refunds are managed as well. So some of this was about auditability, and some of it was about being able to easily make amendments after an initial payment has been made. Within the managing outgoing correspondence bucket, I guess, the key themes included wanting additional letter references for patients and other third parties. You also wanted more flexibility in the letter templating area and to improve how letters are formatted and ensure that, you know, your correspondence looks professional. And finally, you asked for the ability to send letters via an addressee's preferred channel. So this was primarily focused on email and e-fax. Within the appointment book category, the big ticket items for Gentu users were better workflows for scheduling different types of appointments, including managing telehealth and different appointment types. And then other than that, it was improvements to the SMS appointment reminder workflow. We heard that practices, you know, that we heard that, you know, when there was missed appointments, that posed a significant risk to practices. Did not attend, obviously take a lot of time away from the practitioner that they could have spent with other patients, and it can really impact practice efficiency because there's a lot of follow-up that's associated with those. So to support this, you asked for greater flexibility in the SMS workflows and also to be able to configure SMS messaging for different use cases. So for example, a new patient versus a review patient. And then finally, last June, we ran a customer survey. And this customer survey was broad and really asked a series of questions relating to your experience using Gentu. So thank you to everyone who completed this survey. There was quite a few questions in it, but both the survey responses and the free text responses that you provided to us have been incredibly helpful in not only informing our roadmap decisions, but also helping us as a business to inform improvements across support, training, and marketing. In relation to product integration specifically though, we asked which software products you would like to see integrated into Gentu. And on the very top, the number one was digital pathology and radiology orders. Followed by this was practice accounting integration, so specifically calling out MyOb and Xero. And then it was direct GP to specialist referral management. And the fourth one there was electronic bookings to theatre, with over 41% of respondents looking for this process to be digitized. And I'm really excited to share that we've created and released 2 of these top 4 in the past 6 months. And this includes pathology e-requests, with radiology e-requests coming really soon with Sonic Healthcare Labs, and then e-bookings, an electronic theatre booking tool, which we've initially developed with HealthScope, but I'll chat about this in a little bit more detail later so that you guys can see the progress in this space. Now, before we get into those integrations though, let's have a look at the features and experiences that have been created in Gentu off the back of this feedback. So last year, the team completed a significant uplift to the letter writing area. We had over 500 requests for changes to a number of workflows. And so the teams worked to enable practices to be able to place images and letter templates behind the content of the letter. And this is really to enable you to do full page templates where you might want to create a template for a government form or something, but also so that you could properly reflect printed stationery as well. When creating a patient letter, if the patient record includes an email address, the delivery method for the patient letter is now automatically set to email. And when this letter is ready to send, clicking send will automatically send the letter to the patient, the letter to the patient by email. And that letter is actually attached to the email as an encrypted, password protected PDF. Recognizing how important it is for everyone to be able to send information to third parties, the team also enabled the ability to be able to attach documents such as pathology results or clinical images into letters that you send via the SMD, such as HealthLink, Argus, or Medical Objects. And finally, there was some big improvements to how letters were viewed in the clinical area. The clinical history panel used to be quite constrained previously, but now we have enabled this so that it stretches out to fill the white space towards the bottom of the screen. And this really provides a much better viewing pane and reading pane for when you're reading within the patient's clinical file. Within the managing appointments area, there was significant improvements last year to the SMS functionality. So the initial changes in this space included allowing you to create multiple SMS templates and being able to use these templates not only for appointment reminders, but also for the sending of bulk SMSs. So the team worked on enabling additional filters within the patient list. As an example, you can now filter to see who has an active or an inactive referral, and then be able to send an SMS template to that group of people en masse to remind them to bring a referral or to obtain a new referral before their appointment. Later, the team extended this SMS templates and reminders functionality to allow for appointment confirmations to occur, and then to enable practices to set up schedules where they could customize the timing and content by provider or appointment type. So what that means is if you now, within Gentu, you can create a template and you can say that different templates are to be used for different providers or different types of appointments, like a different template for a new patient versus a review patient. And similarly, you can set up different schedules. So you might decide that new patients, you want to remind them 7 days prior and 1 day prior, whereas a review or a post-op patient, you're happy to just have that appointment reminder sent out 24 hours before the appointment time. So a really big shift forward there in the SMS functionality. Next on the hit list for us was improvements to the tasks functionality. Previously in Gentu, this was user to user only. And we really recognized, or the feedback I guess we got, was that many staff are sharing roles. And so we wanted to improve tasks by ensuring that they were no longer private by default. So this enables users to be able to see the tasks of other users. But it also allows you to continue to make a task private if you choose to. We have continued to receive some feedback about the tasks functionality that was already released. So more changes are going to be occurring and updates occurring to this area in the coming weeks. So keep an eye out for these as well. More recently, in the past, probably 2 months or so, the team worked on 2 big changes, or released 2 big changes, I should say. They were working on them for quite a few months. One of which was the introduction of a process folder, and the second of which was procedure templates. Now, while these items didn't appear high in the list of feedback that we received from existing Gentu customers, existing Genie desktop customers told us that these were really important workflows for them within Genie, and they wouldn't be in a position to move from Genie to Gentu until an equivalent workflow was available. So the new procedure templates feature helps massively reduce data entry time and avoids costly mistakes when documenting patient procedures. So in Gentu, you can now create templates that allow you to pre-fill the information to be used when creating a procedure, meaning you don't need to fill in the same fields each time for the most frequent procedures. And this is really a game changer for procedural practices. Another game changer but for admin staff is the process folder, which was released just a couple of weeks ago. And so far, people have been telling us that it is saving them a huge amount of time managing incoming documents. So really great to see that this has landed positively for existing Gentu customers. So the process folder, what happens now is it can be used to upload, link, and process files to patient records in bulk. So this means that in the past, if you had a list of documents, you had to navigate into each individual patient, click on the add function, and add the documents to multiple patient or each patient record individually. What it means now is that if you need to attach files to multiple individual patient records, you can upload those all into the process folder, and then you can identify within that process folder which patient those documents are for. So that's a really exciting step forward, and again, more happening in this space with regards to the review process in the coming weeks as well. Now, the number one area that we received feedback on in the past 12 months was in relation to quotes and invoices, which I said had over 800 requests for improvements in this space. So the team is working in this space, or one of the teams is working in this space right now. And some improvements have already been delivered and others are still in progress. The initial improvements already released focused on quotes, and specifically the ability to create and customize multiple quote templates. This includes letterheads, item descriptions, and fees, and an area to include any information that might be relevant to your practice. So this could be unique payment details, payment terms, or any disclaimers that you want to include on the quote. You can now also choose how the estimate of costs content is formatted, and this allows you to bold different aspects of that estimate of costs and ensure that you can control, what pieces of information are highlighted for the patient. The other big change in this area was introducing the ability to create quotes for third parties. So very similar to the invoice workflow, users can now add a quote and choose the other option from the account type drop-down menu and select a third party such as work cover to be able to create a quote too. You can also link any work cover claim information to the quote for that patient. And this is now going to carry across when that quote is converted into an invoice later. And then finally, but certainly not least, in the financial workflows, the team created the ability to manually move claims from in progress and exceptions to finalized within the claims control area. So we know that claims often get stuck for, a variety of different reasons. And it was really important for practices to be able to tidy up and understand, what was truly outstanding for practices, for an individual practice to follow up and chase. And since this feature was released, I think we've seen more than 4,000 individual claims manually moved from the different stages into a finalized state now within claims control. So obviously it has a huge impact. It has had a huge impact to many of the Gentu practices. So lots of feedback in this area. So it's really exciting to see some of this delivered. And as I mentioned, we're not finished, and I'll talk about what's going to be happening in the coming weeks really shortly. Before I do that though, I am keen to share just a couple of more updates on things that sit outside the core Gentu application, and that includes the mobile app and then e-requests and e-bookings. So recently we launched the Gentu mobile app to be available to everyone. We really have made great progress with the Gentu mobile app over the last 6 months. It's now available to all Gentu users. So this includes clinical and admin users. And it does include enhanced voice recognition functionality as well. So voice is based on the same technology as Dragon Medical One, and is really focused on supporting practitioners to spend less time on clinical documentation and allowing you to translate voice to text live on the screen with great accuracy. And the people that are using this tell us that it saves them hours each week, which is a great outcome. But within the mobile app, so voice is available within the mobile app, but the big change in the last 6 months is that the mobile app is now available to all users, regardless of whether you subscribe to voice or not. And within that mobile app, what you can do is you can view appointments for any practitioner that's in the appointment diary. And that's just a recent change. So previously, you could only view the appointment book for the person that was logged in. But then you can also view clinical notes for patients, and you can create consults, add tasks, and very recently we've just added the ability to create patients on the go and also to make clinical annotations. So again, more happening in the next couple of months in this space, and really exciting workflows being built out, which I'll talk to you about in a moment. And as mentioned earlier, we've delivered 2 exciting New integrations for Gentu. One is e-requests and the other is e-bookings. So e-bookings, which is the one that's on the screen at the moment, is a digital procedure booking workflow that saves the practice time when booking theatre. So this is initially available for Healthscope hospitals, but we are working hard to get it available across other private hospitals as time goes on. And this is free for all practices to use. So what happens is it takes the patient and procedure information that you already have entered into Gentu and shares this across to the hospital's bookings team electronically. So it's removed the need for sending of draft lists to the hospital bookings team. And as you can see down the bottom of this picture, it allows you to upload the consent form as part of the process. So this is massively reducing the incidences where patient paperwork is being lost and is resulting in significant improved practice efficiency across those users that are using it. Patient experiences we're also seeing improved because the booking goes to hospital on the day or very shortly after the patient has actually seen the specialist. The patients aren't, and the hospital contacts the patient once they've actually received that booking. Patients are not being left wonder, what's happening? Is my procedure actually going ahead? Practices are telling us that they're receiving less phone calls from patients asking for updates on their procedures. And it also means that there's an opportunity well ahead of the procedure to identify any issues like health fund eligibility, which can cause last minute cancellations. And so the hospital can reach out to the patient if there is anything identified and understand how the patient wants to proceed with respect to that procedure. So overall, a great outcome. And we're really seeing, significant numbers of practices come on board there and start using that with Healthscope hospitals. Just this month, we launched e-requests. So e-requests or digital pathology requests, as I said, was the #1 requested integration in our survey last year. So it's really exciting to see this one hit the desks of our users. So initially, e-request is a digital pathology requesting workflow that allows you to create, send, and view pathology requests directly in Gentu. And again, no additional cost to practices for this. So we've actually partnered with Sonic Healthcare Group as the first laboratory group for the initial release. It's been available with Sullivan and Nicolaides, which is their brand in Queensland, Northern New South Wales, and the Northern Territory since about November last year. And we just started the national rollout of this, which is across Douglas Hanley Moir, New South Wales, Melbourne Path, and Clinipath over in the Western States earlier this month. So when creating an e-request, the request is sent directly to the lab now, and an SMS is sent straight to the patient from the lab. The patient can then present for the pathology test, and the collection center just scans a code from that SMS on their phone. So we've heard many stories from specialist practices that patients often lose request forms, or there's a need to generate a request form when the patient isn't in the practice. So this means that practices are having to, generate requests, print out requests, scan them, and then email them to patients that aren't present to get a physical copy of that request form. So e-request cuts out, all of the admin overhead of creating and sending requests for patients in these instances. And, we're also hearing that practices are enjoying the greater visibility of the requests. So within Gentu, there is now a dashboard where you can see the status of that request. So you can see if the patient has presented to the lab and actually had the blood collected, and then you can see when it's in testing and when it's actually been reported on. So this means that you don't need to perform, numerous calls, chasing the patient to see if they've had their tests, or even chasing the lab for any outstanding investigation reports that you might be looking for. We've also seen improved patient outcomes. As I mentioned, practices can easily check if the patient has presented for the test, and if not, follow that patient up. But we're also seeing that there is less room for transcription errors. And so what that means is that, patients are more likely to be having the test that the doctor intended them to have, and also having all of the tests. that the doctor had requested as well. So a massive step forward for us with regards to providing interoperability between us and other aspects of the health ecosystem. Really soon, the team is working on radiology requests now as well with Sonic Healthcare. So we're hoping to extend this pathology request to cover radiology requests very soon too. So as you can see, so much happening within the Gentu product over the last number of months. So thank you all for taking the time to share your feedback with us and also work alongside us with this development. Many of you on the call are probably have worked with our teams in helping shape up, you know, what these workflows and products look like. So this is really crucial to ensure that, you know, what we do really meets your needs when we release it within the product. Now, I'm thinking that all of you are also interested in what you can expect to see in the coming months. We are planning to host these webinars more regularly. So what I'm going to share today is really what you can expect kind of within a 3 to 6 month period. So first up is the ongoing work for financial improvements. And this starts with invoice template, which is actually just released last week. So this was in beta and was then just released towards the end of last week. And this has been a recurrent piece of feedback for our customers. So practices will now be able to, or now can create invoice templates. And these can include, you know, doctor-specific information. So for multi-practitioner sites, as an example, you might want to have different information like the ABN or the practice letterhead at the top of the invoice. So you'll now be able to achieve that. And you also can add in some additional information into the invoice templates, such as things like bank details and payment conditions. The team is also working to make quotes editable within the existing workflow. We understand that during the quoting process, sometimes people need to be able to add additional information that's only relevant to the quote for this patient. And you want to do that before obviously printing. So what we're going to do is, you know, once the core quote has been generated in the template, ensure that you can then edit that before you finalize that for the patient. Also, if a practice created a quote for a patient and that quote is no longer valid, at the moment you're unable to do anything to remove it from the patient's file. We're going to enable the ability for either be able to delete or void the quote from the patient's account history in the future. And then finally, the team will release the ability to calculate and bill for item 31340 and make some changes to the banking reports. So that's just going to make it easier to be able to reconcile payments that are associated with third parties where reference ID from the organizational remittance currently doesn't flow into the banking report. Now, the team who recently released the process folder work are continuing to work in this area in the coming months, but now they're going to work on the next stage of this, which is the review process. So the focus here will be to separate the process of linking and reviewing for incoming correspondence and diagnostic reports. So this change will ensure that, you know, any of the documents will promptly appear in the patient record, and that will be independent of the doctor actually reviewing that document. But then there's going to be a review process that allows the doctor to review the document and take any action that's required. The goal here is really to enhance the efficiency of managing documents for patients while ensuring that we maintain the integrity and rigor that I know you guys need for the review process with doctors. The team have been co-developing this solution with a number of practices over the last couple of months. And some of the strong feedback that we've had coming through is that it would be really helpful to be able to SMS patients from within this review process. So the feedback is quite specific to diagnostic request reports, you know, where a user wants to notify the patient to either call the practice and make an appointment, or that no further action is needed. So before the team move away from this area, they'll be looking at bringing SMS capability into this space. Now, we're also working to extend this incoming document review experience into the mobile app. As I mentioned before, we'll be continuing to build out the capability of the mobile app in the coming months. So specifically, right now, the team is working to create a workflow for reviewing of results. And our current plan is to extend this to the ability to review all incoming documents over time. Since the mobile app release, though, we have also received some feedback about the login experience, particularly around wanting to be able to use a PIN number, I think, to log in, and also the absence of MFA within the mobile app. So the mobile team is going to work alongside the Gentu teams over the coming weeks to implement and uplift the multi-factor authentication experience, both across the web application and the mobile app. Now, we've also been aware of a gap in Gentu's ability to provide a comprehensive record for practices. So this is, we understand, when patients move between practitioners, or if there are legal issues, practices may need to provide a complete clinical record for their patient. And we've received about 70 requests for this piece of functionality alone. So while Gentu does support printing of a clinical record, which you can see here on the right-hand side, it does not currently include all clinical file types and categories. So we're going to do the work now to ensure that this print functionality is comprehensive and meets the needs of what you require in these situations where you're transferring care or needing to provide it for legal purposes. The next one that I'm really eager to see underway is the idea of empowered configuration. So for the past 6 to 9 months, the teams have largely been focused on uplifting, various administrative workflows across the Gentu product. So now it's really time to turn our attention to practitioner and clinical workflows and invest quite a considerable time to improve the experience for these users. So this is going to start by enabling configuration in clinical workflows within the clinical record of Gentu. So we want to ensure that users can determine what clinical tools are important to them and where they will be used within their workflows. So we want to ensure that the clinical tools that appear in the clinical area, so think measurements, past history, procedures, diagnoses, adverse reactions, and so on, that you have the ability to decide which of these is relevant to you and kind of configure your clinical experience. We also want to ensure that you have the right you're able to configure your clinical documentation workflows to have the right fields and information that you want to capture. So the team is going to be working on enabling you to create configurable scoring and specialty clinical tools, very similar, I guess, to the checklist workflow in Genie today for people that are familiar with that tool. So this is a big piece of work. It's a big move from a big, I guess, evolution of the clinical area within Gentu. So we expect that we'll be working in this space over the next 6 months or so. Alongside this piece of work, we're also going to revisit our obstetrics and gynecology module. We built this a number of years ago and have received feedback about feature gaps in this area, and also just wanting both improvements to the clinical area for managing pregnancies, but also improvements to pending births and how the obstetric history workflow operates as well. So in the coming months, we're going to be forming a craft group with a number of the existing obstetrics and gynae practitioners to work alongside us and help us improve the end-to-end experience for obstetrics practices. And then last but not least, we're conscious that many of you use products in your practice today that currently do not integrate with PMS. And this has been a big gap for Gentu so far. So some examples include, transcription products, which we've received a lot of requests for, telehealth or patient engagement tools like digital consent or online appointment booking. So over the past kind of 6 to 9 months, the team have been doing the foundational work that's needed to enable practices to activate and switch on third-party products within their core practice management workflow. We've made really good progress now. We have a number of partners on and actually building their integrations. And our aim is to start releasing some of these integrations out to Gentu customers over the coming months. So that's going to be really great to see. The areas of initial focus for us are transcription, digital consent, and then online appointments as we head into the second half of this year. So look, thank you. That is everything that I wanted to share in relation to the roadmaps. Thank you again for all of your feedback in the surveys and what you provide to us, as I said, in our design sessions, but also through our support and training teams. It really is incredibly valuable to us to understand what's important to you. And I hope that you can see that we really do value that feedback, and it does inform the items that are appearing on our roadmap, both for the last 6 months and as we look forward into the coming 6-month time period. Now I'm going to hand over to Lucas, who's going to talk to you quickly about our craft group.
Thanks, Niamh. Now that we've heard about a lot of the exciting things happening in Gentu, I'm here to share with you a bit about how we go about developing new features and invite those of you interested in participating in Gentu's craft group to help shape what those solutions look and feel like. As Niamh mentioned earlier, my name's Lucas Arundel and I'm Head of Design at Magenta's Practice Management, leading the design teams who work tirelessly at understanding our users and developing innovative solutions to fulfill our purpose of helping medical professionals deliver better health outcomes. In this short session, we'll cover why do we have a craft group, what is it, and how can you participate? So starting with why. We believe that software should be something that you want to use rather than something that you have to use. Ultimately, most of you are in the industry to work with patients, not with software. Our approach to building both Genie and Gentu places you, the user, in the center. Our solutions are designed in a highly collaborative way and really guided by you. As an enabler of this user-centered design, our design and product teams use a thing called design thinking. This is a process which places a strong emphasis on building a deep understanding of our end users before we jump into solution mode. And finally, this can be done through various methods of user experience research, such as one-on-one user interviews, data analysis, desktop research, on-site visits, and even focus groups. So here's an example artifact that we have up on the walls in our Brisbane office. In this photo, you can see an incredibly detailed medical professional journey map, which our design team has built to create a shared understanding of the context, workflow, and interconnectedness of your jobs. As we're working through this with users on new features, this map helps place those features in a real-world context and helps us to look for ways to speed up repetitive tasks, to reduce friction in your workflows, and ensure that the right information is available at all points throughout that episode of care. As Niamh mentioned earlier, we have a broad range of inputs that are collected into our Voice of the Customer repository, with over 11,000 pieces of feedback able to be drawn upon to ensure that we're listening to our customers and their problems. Now, this really helps with identifying which user problems to focus on, but when it comes to taking action on what we hear, the VOC is really just the beginning. Getting from problems to solutions is really the bread and butter of our product and design teams here at Magentus. And although design and software development can seem like discrete, separate technical tasks, all of our teams working on Genie and Gentu come to work each day with this problem-solving mindset. And in reality, it's not really that linear. Usually it's a process that looks a little bit more like this. So I mentioned before user-centered design. Our design and product teams follow these key steps in design thinking, which are made up of understand deeply, create strategically, and learn iteratively. So what do each of these stages mean? So understand deeply is really focused on taking the time to explore our users' problems and understand them closely while working with them before spending time on the solution. Albert Einstein famously said, if I had an hour to solve a problem, I'd spend 55 minutes thinking about the problem and 5 minutes thinking about solutions. And we've seen great results taking a similar approach in the way we design solutions. So next, creating strategically. This is really about rapidly trying out solutions to directly solve for the needs that we've explored with users. Here we ensure that we take a pragmatic step about finding a solution, because we aim to get a well-designed solution in your hands as soon as possible. During this phase, we often build out interactive prototypes, mock-ups, and test scenarios with our users. And finally, learning iteratively means that we take a pragmatic step forward with designs to make sure that we can quickly get user feedback and then adjust or iterate on the solution. Many of our craft group members have found this to be quite an exciting step of the process, as the design team are able to respond quickly to feedback and redesign based on that feedback. So going back to why we have a craft group, really because our users are the key to delivering great solutions. And in order to engage in a more meaningful way with you, we've created the craft group because we know you're all very busy. So what is the craft group? The craft group is a group of customers who have expressed interest in participating in ongoing engagements with us to test out new ideas. It enables members to help shape the future of Gentu through their personal insights, needs, and preferences. And as we work through the Gentu roadmap, we reach out to you to seek feedback on relevant development areas. Rest assured, project participation will be determined by your interests and your availability. As you can see in the graphic here, this is a basic depiction of the process. We start with a problem to focus on in the product team. Then we reach out to users in the craft group, and that's where we would do one-on-one interviews. And then we might often come with prototypes or concepts in the first set of interviews, or just start by hearing your perspective. And then often we might come back for another round with additional prototypes or with adjusted prototypes to seek that extra round of feedback. Then usually we go through to beta testing, and then the feature becomes available. As I mentioned before, the engagements are usually 30 to 60 minutes and able to flex around your availability. And there's really no preparation needed from your side. Really, all that we need from your time is to hear your perspective and get feedback. And as I mentioned before about the beta group, many craft group members have been quite engaged after the first session and often want to come on board to be beta testers. And this really just means being able to try the feature live in your actual, in your Gentu, and of course give feedback as you go before we refine that into final testing. So if this sounds good and you'd like to participate, really the next step is to indicate in the survey after this webinar, or to reach out to a Gentu representative to show your interest in the craft group. So I hope you've enjoyed learning about the craft group and to see how things are done here at Magentus. We really enjoy engaging with our customers, and it's really crucial that we hear from you in ensuring that we shape the right solutions. So as we near the end of the webinar, really thank you for watching from both Neve and I. Reminder that if you need help, we've got support lines open. We've got web form and live chat available in Gentu. Of course, if you're interested in learning more, there's always the knowledge base. We host lunch and learns, as well as tailored learning, which you can reach out to your Gentu support team for that. And otherwise, we hope this has been useful, and you're as excited as we are to try out everything that's happening in Gentu. Thank you.